Good day and hello. My name is Dr. Termika Smith, and I would like to welcome you to today's CDC Partner Update call on COVID-19. This call serves as a way for CDC to share weekly updates on COVID-19 and our latest resources and guidance, especially for the private sector and other partners. The topic for today's call is what you need to know about cloth face coverings, but we will also cover more general updates and information. For the agenda today, we will hear from our COVID-19 response Chief Medical Officer on where we are with the response and about what everyone should know about protecting themselves and others. We'll then turn to our subject matter expert who will discuss CDC's considerations for wearing cloth face coverings. Afterwards, our speakers will take questions from the audience. Please note, this call is not intended for media. Media can direct their questions to media@cdc.gov. Again, that's media@cdc.gov. This call will be recorded and later posted on the CDC COVID-19 website, as well as on YouTube. All past partner calls can be found there, so please take some time to review and share prior recordings. If this is your first webinar with us, these weekly calls occur every Monday at 3 p.m. Eastern Standard Time. Please see the link on the slide to subscribe to our mailing list to receive future CDC COVID-19 Partner Update webinar invitations. Note, there are 2 listservs that support this call. So if you have missed an invitation over the last few weeks, please click the link provided to ensure you are on both listservs. I would like to remind all participants that the CDC website has the latest information, guidance, and communication resources. There are nearly 2,000 documents providing information and guidance for individuals, businesses, and the general public on our website. In addition to the tools we'll highlight today, some resources posted within the last 2 weeks include interim considerations for K-12 school administrators for SARS-CoV-2 testing, playing youth sports, isolate if you are sick, quarantine if you might be sick, visiting beaches and pools, living in or visiting retirement communities or independent living facilities, people who are at increased risk for severe illness, and considerations for traveling to amusement parks and carnivals. Thank you to those who sent questions in advance. We have already teed up a few of those, and I'll also be keeping an eye on the Q&A box, so please feel welcome to submit questions there as well. We will not be viewing the chat box, so please use the full functionality of Q&A. I am pleased to be joined today by 2 CDC experts, Dr. John Brooks, the Chief Medical Officer for the COVID-19 response, and Dr. Michael Bell, Deputy Director for the Division of Health Quality Promotion. For those of you logged into the webinar platform, there will be very few slides used today, so don't be alarmed if they do not seem to be advancing. Additionally, a transcript will be provided along with this video when it is posted online to YouTube. I'd now like to turn it over to Dr. Brooks for some quick updates. Thank you so much, and Dr. Brooks, over to you.
Well, thank you, Dr. Smith, and welcome to everybody for joining us today. It's great to have so many people on the call. It looks like we're over 500, so thanks. As Dr. Smith mentioned, I'm Dr. John Brooks, and I'm the Chief Medical Officer for the COVID-19 response. And I'd like to take a little bit of time today to provide a brief update on the COVID response at CDC and some of the latest scientific developments and guidance in addition to those that Dr. Smith mentioned just a moment ago. Just to orient everybody to what the world situation is, unfortunately, we're now at 11.1 million cases worldwide, with over 500,000 deaths, 528,000 deaths worldwide. Here in the United States, we're seeing COVID is still a very substantial problem. There have been over 2.8 million Americans with confirmed infection and over 129,000 who've lost their lives to COVID-19. And I'll note that worldwide, the US constitutes about 4% of the world's population. But today, worldwide, of all the cases and deaths I mentioned before, deaths and cases in the US constitute for 25% of those totals. While the past few weeks had seen cases begin to trend downward after a period of increase during which we were all staying at home, a number of states across the country, particularly in the Southwest and Southeast, are seeing increases. Evidence is telling us that these increases are driven by many factors, including outbreaks in settings that present particular challenges where people are close together for a prolonged period of times and not wearing face coverings, which we'll talk about later. Also, we're having challenges with increased testing and community transmission as well. Currently, the United States is in an acceleration phase of the epidemic, so it's growing, as I've said twice now. Duration and severity of each phase will depend on the characteristics of the virus and our public health response, and we want to bend that curve as soon as we possibly can. CDC, as well as our state and local partners and health departments and laboratories, are testing for the virus that causes COVID-19, and all 50 states, as well as our 7 territories, have reported cases of COVID-19 to CDC. Cases have included imported cases from travelers, cases among close contacts of a known cause, as well as community-acquired cases where the source of infection is unknown. I encourage you, with all my colleagues at CDC, to please visit our COVID View website. It's cdc.gov. You can do cdc.gov and then look for COVID View. And this is where you can find a weekly summary, plus an interpretation of our key indicators that have been adapted to track COVID-19's pandemic in the US. I'd also want to discuss for just a moment now how important it is and what we can do to minimize stigma and misinformation. Stigma is the enemy of public health, and we intend to fight stigma by supporting people who are coming back to work after completing their quarantine or their isolation period if diagnosed with COVID. Someone who's completed their quarantine or met the requirements for discontinuing infection control procedures does not pose a risk of spreading COVID-19 to others. And very importantly, people of Asian descent, including Chinese Americans, are not more likely to get coronavirus than anyone else. Let people know that being of Asian descent does not increase the chance of getting COVID, and certainly these people are not the source of COVID for spreading it further among the American people. Viruses cannot target people from specific populations based on their ethnicities or racial background. People who have not been in contact with a person who is a confirmed or suspected case are not at greater risk of acquiring the new infection than others. Now, people who returned after more than 14 days ago. So let's say you were overseas in an area with widespread or ongoing transmission, and it's been 14 days since you have come back from that area, and you don't have any symptoms of coronavirus and are feeling fine, then you've completed the quarantine period, the period during which a person would be expected to develop illness, and you don't pose a risk to others. To help counter stigma, employees can do a couple of things. I think really importantly is maintaining privacy and confidentiality of those seeking healthcare and maybe part of a contact investigation. It's difficult sometimes as an employer. You want to help all of your employees, and part of helping is to also making sure that people's confidential medical information isn't inadvertently disclosed to their colleagues. It's important for all of us to communicate the risk or lack of risk, actually in many cases, from associating with products, people, or places in a timely manner. We need to raise awareness of COVID-19 by showing empathy for people's concerns and fears. It's natural to be concerned and sometimes very frightened by this. In fact, for some people, it can be paralyzing. And if you know information and you can share that information about COVID, you can help them move forward. In fact, it's very important in particular to counter myths and rumors by sharing accurate information about how the virus spreads. And if we have time and there are any questions on that topic, myself and Dr. Bell would be more than pleased to talk to you about that. Speak out against negative behavior, including negative statements on social media about groups of people or excluding people who we know pose no risk due to their regular activities, okay? And share with others the need for all of us to socially support one another, and particularly for people who've experienced stigma or who've returned from an area of ongoing spread. They can be very effective communicators. I want to give a little bit of a scientific and medical update before I turn it over to Dr. Bell and cover a couple of things that I think you might be interested to know. First, a new CDC survey, which you might have heard of, showed that at least 10 times more Americans, and that's at least 10 times more Americans, have been infected with the virus that causes COVID than the number of reported cases. So it's this iceberg effect. That means that this number potentially reflects people who were never tested because they didn't have symptoms. They had very mild symptoms, or they may have been ill but they chose not to seek medical care, couldn't get medical care, or they sought medical care, but they never got tested. So that ratio of 1 to 10, for every person who gets diagnosed, that means that there are at least 10 people who we think have been infected, but for one reason or another didn't make it to testing so they could be counted that way. These surveys look for antibodies to the virus in leftover blood samples from diagnostic tests, such as cholesterol tests and other places where blood is being collected. And while the people whose blood samples were tested may not be completely representative of the general US population, they're pretty close. And these results indicate that many more people may have been infected with the virus at some time point since the beginning of the pandemic, more than our official case count numbers are showing, because we can only see the people who get tested for COVID. CDC has also updated who we believe is now at increased risk for more severe illness from COVID-19 and at greater risk of dying. Age and underlying medical conditions remain key determining factors, but there have been some shifts. First of all, we no longer say that the risk is greatest for people over age 65. For those of us who have turned 65 or are getting close to it, there's nothing magic happens the day you wake up after your birthday and you're 65 in one day. It's really age as a continuum, and risk starts to begin increasing with people in their middle adult years and then up steadily into the 8th and 9th decade. And the older you are, the greater the risk. In addition, the more underlying medical conditions a person has, the higher their risk. So having one condition raises your risk, but having more than one increases, and with each one you add, the risk increases even more. We're always concerned about pregnancy because it's a particularly vulnerable population, and there are some data that pregnant people might be at somewhat increased risk for severe illness. I think that's still a little controversial, but it merits paying attention to, and I think we should consider that for those of us who encounter pregnant people. And in light of these days, it's clear that a substantial number of Americans are at increased risk of severe illness, highlighting the importance of continuing to follow preventive measures so you don't have to worry about what could happen if you got sick. Summer's here, and summer means beaches for many people. And while others try to beat the heat and the odds through, while others try, the beach means a lot for some people. I'm going to come back to this. Summer means beaches. A lot of people are going to the beach, but others are trying to beat the heat with air conditioning and beat the odds through gaming and casinos. Everything we do has some risk associated with it. And so CDC continues to expand its guidance to help people make decisions about which activities they will choose to resume and how much risk they're willing to individually accept. And we now offer considerations tailored for beach managers, casino and gaming operators to help protect staff, visitors, and customers, and of course as well to slow the spread of the virus that's causing COVID-19. Just one MMWR to mention of interest. A recent MMWR showed that half of COVID-19 patients were aware of a recent close contact with someone with COVID-19. Let me say that again. A half or fewer were aware of having been in contact with somebody who had COVID-19. This report highlights the need for screening, case investigation, contact tracing, and isolation, because that other half of people couldn't recall having been in touch with somebody who might have been infectious, and that's the purpose, among some, of contact tracing. Okay, I'd like to turn it over to Dr. Michael Bell to talk about cloth face coverings, and then we'll be back after that to answer some questions that you have. Dr. Bell?
Hey, Dr. Bell. I think you might be on mute. Dr. Bell?
Well, I'll tell you what, Dr. Smith, let's do this. Let's see if we can wait till Dr. Bell gets on. But if there are any questions about what I just spoke about, maybe we could entertain one or two of those while Dr. Bell is trying to get back online. I'm sure it's like a glitch in our systems. All of us are learning to telework these days.
Yes, goodness. And actually, sure. And you know what? Let me ask you a question that I already know is a hot topic that Dr. Bell will probably also cover, but I know it's already the hottest of topics, and that really is around those little exhalation valves that are in those masks. We've talked about this one before, but it is a hot topic. So as I said before, I keep seeing cloth-based masks with exhalation valves on them. Are those safer to wear than cloth-based masks without those valves?
Okay, well, I see that Dr. Bell's telling us that he's back on.
Oh,
but
there
what we'll
he
do,
is.
let's go ahead and answer this and then move
Yes.
on. So this question is, you can answer it a couple of different ways. First, there's the common sense approach, right? If the purpose of a face covering is to prevent your breath from going out in front of you or to the side of you, sort of towards the person you may be facing, then a valve that releases some of the air behind the mask in that direction isn't as good as one that does not, that doesn't have the valve. We know from a nice study just last week, I think, where they kind of visualized with a laser what it looks like when you breathe out through a mask and where the kind of your breath goes. And a lot of it kind of goes back, a lot of it's captured by the mask, but a lot of it goes back behind you or back over your head, but not in front of you. And that's really what we want. But with that valve, there's a risk that could move forward. And it's for this reason that for many years in the world of tuberculosis, where we also, another airborne infection, we worry a lot about TB, they strictly prohibit the use of valve masks for patients as they are leaving isolation. You know, a person with TB may be kept in isolation so that they can be treated. And that isolation room has air moving in a way that takes the dirty air out and brings in fresh air. And when they're ready to leave, although the staff can use a valve mask, because it's a little easier to breathe, frankly, with them, that's okay because they don't have TB and they're not going to suck it in through that valve. The valve's one way. But the patient with TB cannot wear the mask because there's concern that they could release tuberculosis germs through the valve in the mask. I don't know if, Mike Bell, you had something you might want to add to that.
Dr. Bell?
But we can't hear you yet. I see you feverishly pushing unmute.
It's okay. I know you're coming.
How about now?
Fabulous.
Oh, there you go. Yay, success.
Okay.
Dr. Bell.
Hooray.
So here I am. I am so sorry, everybody. Well, so Dr. Brooks, thank you. And yes, just to wrap up that one question, the exhalation valve on respirators acts like a rifle barrel. And so it shoots air that you're breathing out directly at what you're facing, and that's exactly what we don't want. And I'll tell you why in just a second.
Okay, I like that. Now I'm going to use that, okay?
That's intense. Okay.
It's visual, right? Well, so hello, everybody. This is Mike Bell. I'm CDC's, I'm the Deputy Director of CDC's Division of Healthcare Quality Promotion. And today I'm going to be discussing cloth face coverings that are recommended for use in public places. I'm going to be talking about what they are, why they're necessary, and who should wear them and when, as well as a few special considerations related to face coverings. So the cloth face coverings that we're talking about are simple barriers. They're designed to contain respiratory droplets, or that is, to keep people who are wearing the covering from breathing out infectious droplets. That's something that we also call source control. This is in contrast to surgical masks and N95 respirators that are considered protective equipment. These are occupational tools, work tools, that are intended to be used by healthcare personnel in order to protect the personnel while they're providing care for patients that might be contagious. So N95s and surgical masks protect the wearer. The cloth face coverings that we're talking about are to keep the person wearing the cloth cover from breathing out onto other people. So it's to protect the people around the wearer. This is important because with many respiratory infections, we generally expect people not to be infectious until they start having symptoms like coughing or sneezing. Unfortunately, we've learned that with COVID-19, there can be infections without any symptoms. And still, that person who's infected will be releasing virus that can spread to others. We're also seeing that many people who go on to have symptoms start releasing virus before they realize they're sick. This is why having everyone use a cloth face covering when they're in public is so important. COVID-19 spreads mainly by respiratory droplets that are produced when we talk, cough, sneeze, or raise our voices like shouting or singing. We've seen a couple of examples now of extremely efficient spread of COVID-19 related to choir practice. It's a perfect situation where a lot of people are generating a lot of respiratory droplets in an indoor space. Those droplets cause an infection when they land in someone's mouth, nose, or eyes. They can also cause an infection if they're inhaled into the lungs by somebody nearby. Now, I say nearby because there's not any evidence right now that COVID-19 spreads over long distances like tuberculosis or measles does. But at near range, within a few feet, you could conceivably inhale what people are breathing out and get an infection that way. We do have increasing evidence today that source control, the wearing of a cloth cover, is an effective measure for COVID-19. We have both clinical and laboratory studies that show us that having a simple cloth barrier over your nose and mouth greatly reduces the amount of respiratory droplets that you produce when you speak. It also reduces the distance that those droplets are able to go if they do get out. So you're less likely to be an efficient transmitter to the people around you. For that reason, we recommend that you use a cloth face covering anytime you're in a public setting when you're around other people outside of your own household. Obviously, if you're only around the people that you share a home with and you're in close contact with all the time, adding a cloth cover when you go out to protect them doesn't make any sense. You're already sharing space and air and so on. But if you're in a situation where you might encounter somebody who's not part of your household, that is a public setting, that's when we would say that you should be wearing a cloth face cover, ideally the entire time. We recommend cloth covers for anybody who's older than 2 years old. And we don't think anyone under 2 can reliably wear one. The other group of people that we don't think should wear a cloth face covering are people who have lung conditions like emphysema or heart disease that makes breathing difficult. For those people, it would be better to stay home and avoid gatherings and social settings where you might spread infection to other people. Of course, it should go without saying, but we'll say it anyways, we don't want you to put a face cover on anybody who's unconscious, incapacitated, or can't take the face cover off by themselves if they start having trouble breathing. That would be dangerous. Likewise, it should go without saying, but we'll say it anyways, if you're sick with respiratory symptoms that could be COVID-19, you shouldn't be going out in public. You should stay home except to get medical care and stay as much as possible in a room by yourself, away from other people and animals in your home. You should keep your face cover on in your home anytime you're with other people, and you should most certainly have a face covering on before and during any trips to go for a medical care visit. Now, a few special considerations related to face coverings. I think it's important to realize that while the vast majority of the general public can and should wear a face covering, there are some people who, for physical or mental health issues, are unable to do so. And for those individuals, a discussion with your healthcare provider and a plan to keep you safe and to keep you from infecting other people should be tailored to your medical and mental health needs. We don't want a face covering to make you less healthy than you already are. So work closely with your healthcare provider to figure out the best fit for you. Another group of individuals for whom special considerations are needed are those who are hearing impaired. For those individuals, it's not so much about the cloth covering that they're wearing, but the reality that people around them, if they rely on lip reading for communication, it would not be able to show their mouths as they speak, and therefore communication can be hampered. There may be some options for partially transparent face coverings that could help. Other options, such as closed captioning and ways to improve communication for the hearing impaired, should be implemented to overcome that challenge. There are individuals who may have developmental or neurologic conditions that make it very difficult for them to use a cloth face covering. And there again, working closely with their primary care provider is essential to make sure that the best options can be identified for them. Lastly, let's talk a little bit about kids, and then we'll say a word about workplaces. Kids are a challenge. It is very difficult to get a young child to maintain a cloth covering for a long period of time, for example, the entire time they're at school, if schools open back up. In that case, we recommend that you identify the times when children are most likely to be close to each other and unable to maintain a safe distance from other people. For example, between classes, when children are moving from one classroom to another in hallways, would be a perfect time to insist that all of the kids keep their masks on. Once they're back in a classroom in a situation where distances between students and others are appropriate, it might be reasonable to give them a break and let them take their cloth coverings off. But trying to get them to keep them on as much as possible during those important moments when they can't maintain a distance from others is one approach to consider for children. In workplaces, the cloth face covering is something that needs to be considered very carefully. It's essential that employers think through what the options are for appropriate face covering use based on the specific job type, including occupational health and worker safety services to make sure that unintended problems like masks getting caught in machinery or heat stress related to working in a hot environment with a mask on don't contribute to dangers for workers is a very important component. So thinking about how we best tailor cloth coverings for situations where individuals are working is an important component. One thing to think about for individuals who work outdoors, people may assume that because they're outdoors, they don't need to wear a cloth cover. But if there are vehicles that are shared to transport the workers, or if there are gatherings or meetings between shifts, for example, then during those times of close proximity, once again, you would want people to have a cloth covering on the entire time. Lastly, a quick word about face shields. There have been questions raised about, can we just use a plastic face shield for source control instead of a cloth cover? Face shields are great as a barrier to protect the wearer. They're a great way to keep splashes from hitting your eyes, nose, or mouth. And so we like them for that. But as a way to keep us from breathing out infectious droplets, there's no evidence so far that shows that they do a good job of that. So for source control, a face shield is not a good replacement for a cloth face covering. We would still very much prefer that people wear cloth coverings in any situation possible. With that, let me turn it back to Dr. Smith to start managing some of the questions that we've received.
Great. Thank you so much to both Dr. Brooks and Dr. Bell. This is probably one of the most exciting topics we've actually had. I think we probably reached a max number of questions received that we've actually ever received, now that I think about it, from pre-asking of information. So thank you guys in the audience for sending your questions ahead of time, and thank you to those who are dropping a few questions in the Q&A box. So we're going to start first with Dr. Brooks. This is a pretty interesting question, and one that we've gotten before. So I look forward to your answer on this because it's a pretty hot topic also. So Dr. Brooks, I run a business, and for the safety of my customers and employees, want everyone to wear a mask when they come in. What do I need to know about requiring masks for entry? And am I allowed to bar entry to people not wearing masks? And then again, what if someone says they have a legal or medical exemption? Are those exemptions real?
Wow, that's a great question. And we have heard that before, and things change, but I don't think our response to this one's going to change a whole lot. So starting with the last question first, you know, if, and would you remind me again, what was the third part? It just went right out of my head.
It's okay. It was a long question. So the third portion of the question is, what if someone says they have a legal or medical exemption? Are those exemptions a real thing?
Yeah. So, yes, in some cases, there are definitely people, and I think Dr. Bell reviewed some of the circumstances where this is true, that people can't tolerate wearing a face covering. And so there are people who legitimately that would be very hard to do. But I think those people are the exception rather than the rule, and we're always worried about the phenomenon where people may invoke special privilege, kind of taking advantage of those for whom they don't have a choice because they need that privilege. But you'd have to check with your local, what the local laws are in your area with regard to, what the certification may be required, if any, because they may not have thought about this, for special exemption. That also relates to whether you can bar or stop somebody from entering your premises. Again, it depends on the nature of the business and if it's a public accommodation or not. And every local jurisdiction has laws around, what's permitted and not permitted with regard to accommodating people locally. You wouldn't want somebody to misapply a mask rule, when there's no legal justification or reason to do it. I think, though, it's important to always appeal to people's common sense, and posting a note at the door of the business saying, we want to end the spread. Everyone here is wearing a mask. Doing whatever you can to promote the value of these face coverings that Dr. Bell went over, and we can discuss again if folks need, but we have plenty of evidence that these are doing something, and they're certainly a lot better than doing nothing. So we love it when people can help promote this and are working with us. But whether you legally can exclude someone may be a question for your local law, the nature of your business, and could require consulting a lawyer. I don't know, Mike Bell, did you have anything you wanted to add about that? And the mute button's in the bottom left. It kind of disappears unless you hover over it.
Oh, we can always loop back around,
Yeah.
Dr. Bell. Not a problem.
Mm-hmm.
So Dr. Bell, thank you, Dr. Brooks, for that. I think that was an important point to make. Always check your local laws. But again, just a strong encouragement for those to wear masks who are entering businesses. It helps everybody.
And can I just say one more thing? We have on our website, if you look, and maybe you all can send it out as a link, we've got materials that you can print out, like posters and handouts and things explaining why we all need to wear face coverings. And I think those are sometimes very helpful to have, as well as I think we've got one, unless it's moved, on how to wear a mask properly. I just want to put a plug in for, masks only work as well as you use them.
Right.
Putting it so it's under your nose or hanging off your ear or you're covering your eyes, which I have seen. I have, honest to God, seen that. That's not working for you the way it will if you put it over your mouth and your nose. Just make sure you use it right.
Awesome. Thank you, Dr. Brooks. Dr. Bell, a question for you. What kind of masks are most effective? And is there a way for me to tell if my mask is working correctly? Let's see. Were you able to work with your mute button? Okay, we'll come back to you, Dr.
Hello, can you hear me now?
Oh,
Yay!
there you go. Yay!
Oh, good. So any sort of mask, any sort of face covering made of fabric is fine, as long as it covers your nose and mouth. Obviously, you don't want something that has, great big holes in it, but a couple layers of cotton blend type fabric would be just fine. I think that the way to tell if it's working is really just, are you covering your nose and mouth completely? There are often questions about things like the fit over the bridge of the nose. I think you need to deal with comfort-related issues, so that, for example, you're not fogging up your glasses like I do. But aside from that, having the cloth right over your nose and mouth in a way that blocks any exhalation, but doesn't keep you from breathing comfortably is what you're after.
Perfect. Thank you. I've got another question for you, Dr. Bell. The writer said, I have a disability where it is difficult for me to breathe, and wearing a cloth face mask poses additional challenges. What should I do to protect myself?
That's a great question. And it's a great question because of that last piece. Remember, you're not wearing a cloth cover to protect yourself. You're wearing the cloth cover to protect other people. And so if you're unable to wear one, realize that that means you have to be very, very careful about maintaining an appropriate distance between you and everyone else that you might accidentally infect. It also means that being in a gathering with lots of other people or in a situation where you can't control how close people come to you, those are things that you'll want to avoid so that you don't cause a bunch of infections by accident. Your own protection really relies on other people wearing their cloth covers. It also is a reason to be thinking a lot about, how you can remain home as much as possible and avoid exposure to crowded settings.
Yes, great. It's always going back to the original statement of I wear one for you, you wear one for me. So let's all get those cloth face coverings on our faces, covering our nose and mouth. Okay, Dr. Brooks, over to you. The writer said, I see lots of masks on the market that come with carbon and HEPA filters. Can you explain how those work, and are these filters effective?
Well, I'll confess, I'm not an engineer, but these kinds of things, in other circumstances can help filter air that's moving through them and remove particles. But I really want to come back to what Dr. Bell said, which was you got to find the one that fits and is comfortable that you can use. And certainly adding a little extra filtration may make you feel a little bit better, may have some benefit. But if it's at the expense of you having, having a hard time breathing through it, I think you're better off using a mask without one than forcing yourself to use one with one that you might not use the right way.
Mm-hmm. Perfect point. Dr. Bell, anything to add on that?
Well, I'll just say that, the cloth coverings that we're talking about, as I said before, are simple barriers. They're there to block the sprays and droplets that you're producing when you speak. They're not necessarily intended to be filters. A filter means you need to breathe through the material in order to have benefit. That's why N95 respirators have to be fitted so tightly against your face so that there's no leakage around the edges. That makes sure that you're breathing in and out through the filter material. It's also what makes it, like Dr. Brooks said, very difficult to breathe through. For a cloth face covering, we're talking about a simple barrier that just needs to sit comfortably over your nose and mouth, right up against your face, but you don't have to do all of your breathing through the material.
That is perfect. Thank you so much, Dr. Bell. So this question is also a question for me. It came in from one of our listeners, but it says, if I'm exercising, do I need to wear a cloth face covering? I know I like to tend to go running in the afternoon or early in the morning, and or possibly just kind of get out and do some exercising overall. Do I actually need to wear a face covering? So I'll shoot it over first to Dr. Brooks, and then Dr. Bell, please fill in as you like.
Yeah, I think sometimes people may have the impression that we're talking about wearing face coverings all the time outside the house. And that's not what we're talking about. I think, as Dr. Bell mentioned, it's really when you're in those circumstances where you're going to come in close contact with somebody else, or you can't avoid those persons coming in close contact with you. It's true, as Dr. Bell also said during his points, that when you're exercising or doing other work that causes you to breathe hard, you're producing more respiratory particles. But really, the good news in your favor here is that if you're outdoors, dilution is the solution to pollution. The more fresh air that's out there, the more that what you're breathing out is being diluted and becoming less and less of a risk to other people. And I think as long as you're jogging and there are not a lot of people around you, you probably are okay going without a face covering. That's alone in a place where no one's going to be around you. But if you're on a track outdoors and there are lots of other people running on the track with you, that's definitely a circumstance where you'd want to consider wearing a cloth face covering. Dr. Bell?
Yeah, I agree. I think in addition to what Dr. Brooks just said, if you are exercising indoors in a place where other people are, then you definitely want to keep your cover on. I will share that, I do a 4-mile walk in my neighborhood most mornings, and it is humid and hot in Atlanta. But I keep my mask on mainly because I don't want to take the chance of going around the corner and coming face to face with one of my neighbors. And so as a courtesy to them, I keep it on, even though it does get a little bit sweaty.
Yeah, I think that's a really good point. You definitely should have it on you, so that if you don't have it on already, that if you see that encounter coming, you can get it on quickly.
Yep.
Perfect. And that's really funny, Dr. Bell, because that was the next question I was going to ask you. With it being summertime, it is super hot, super humid. We're in Atlanta, Georgia. Oh my gosh. You know how that is. So, face coverings will get damp very fast. And so the question that we've often gotten was, does that make the face covering less effective? But I really like your idea of, you still get that face covering on.
Yes, it doesn't change the effectiveness of the face covering. So having it be a little bit damp and humid from breathing is okay. You can still wear it. You shouldn't wear it if it's uncomfortable or makes it difficult for you to breathe. Right, like we said before, if it's causing you distress, then you need to get away from other people, ideally go home, and take it off. Similarly, you do need to maintain it. If it gets damp on a regular basis, you're going to want to launder the cloth covering and make sure it dries completely before you use it again. Basic hygiene, if you think about this, similar to your pillow pillowcase. It's a fabric item that you put your face up against every night, probably for much longer than you use your cloth cover. And so you're going to want to launder it periodically. You don't need to worry about, I've had questions about, once it's damp and I breathe through it, won't it cause me to get sick? And the answer is not any more than something like your own pillowcase. Basic hygiene and common sense there is what you need to make sure that you keep your mask clean and functional. If it's damp, it'll still block secretions.
That's a good point. I want to add that there's a myth going around that face coverings cause you to re-inhale your carbon dioxide, and that can be bad for you. And there's no evidence whatsoever to support that.
Great. Thank you. You just knocked off another question. Perfect. I love it. Keep it going. All right, Dr. Bell, and also for you, Dr. Brooks, but we'll start with Dr. Bell answering first. This is a problem I think many people run into and really would need some really, sage advice if you have any. What should I do if I'm in a room with someone who doesn't want to wear a mask? Does CDC have any advice for approaching this kind of situation and communicating effectively?
Nope.
Go ahead, Dr.
So
Bell.
I'll go first and then hand it to Dr. Brooks. I think that your first and most controllable option is to simply move away from the person. That is something that you generally have control over in most circumstances. If for some reason you don't, or if the person continues to come closer to you, I think it's very reasonable to express that you're a bit concerned and would prefer that they either have a cloth covering on or maintain a distance like CDC recommends. I think you can point the finger at CDC and say that we recommend it, and therefore you're asking that this person do that as opposed to try and be bossy at them. But I do think that anyone who is uncomfortable because somebody who is not wearing a cover that is not part of the household is coming close to them deserves to be able to speak up and express that concern. Like I said, though, the most efficient thing may well be not to get into an argument, but simply to move away from that person. So, for example, if you're headed towards the eggs at the grocery store and there are people there without masks on and you're uncomfortable, maybe do some vegetable shopping first and then come back to the eggs later. I think there's practical solutions like that as well. Dr. Brooks?
I concur completely, we are more than happy for you all to let CDC be the hammer here, if you need it, to defend what you're doing.
Perfect. That's right. Blame CDC. We'll take the blame for that one.
This is one we don't mind taking the blame for.
Right. Dr. Brooks, one question for you. So after contracting COVID-19 and experiencing acute illness, how long does an individual remain contagious? And what is the time frame for continuing to shed the virus?
Okay, great question. So we know a lot more now in the 6 months since COVID first sort of hit the scene back in late December and January. And this is what we know. We have a couple of studies now that have looked at how long can you recover live virus from the respiratory secretions of a person who's infected. And there now are at least 6 studies which show that it's very hard to culture live virus from the respiratory specimens of sick people more than 10 days after they've been ill. So more than 10 days after their first symptom came on, whatever that might have been. It may not have been a cough or a fever. It might have been they lost their smell, or they had a bad headache, or they felt achy, but then it turned into COVID. So you start counting from that first day. Now, in people, that's for most people. For people who have been really sick, and I mean sick like they're in the hospital requiring oxygen, they may be there for a couple of weeks, very severely or critically ill, it may take up to 20 days for those people to stop shedding live virus, but usually they're already in the hospital for such a long time that they're not going to be leaving before they reach that time point when they're that sick. Then, what we've noticed is something really unusual and kind of a little unexpected, which is if you keep testing the person to see if viral RNA is there, some people can keep having a positive specimen. That PCR test is the one we use for diagnosis, and it looks for the presence of the genetic material in the virus. And we're not quite sure yet why this is happening, but after people don't have live virus anymore coming out of their body, we can still pick up the DNA that probably represents dead virus, and it's part of their recovery, that they're continuing to shed these virus particles as part of getting well. How long can that go on? Right now, the record is 83 days, although I was saying to somebody, I heard of a case that might be 91 days today. So it can go on for up to 3 months, although most people, it stops. If not at the time you start to feel better, then within about a month and a half.
Perfect. Thank you, Dr. Brooks. Dr. Bell, I'm going to hop over to some late breaking questions, if you don't mind. Question for you, Dr. Bell. I have been wondering about making masks with antiviral materials. Is that possible? Also, what about weaving certain metals into the cloth mask? Could that make the mask more effective against virus?
That is a great question. So there are antiviral products, and there are certainly metals like silver and copper that are shown to inactivate viruses. There's nothing wrong with doing that as long as those treatments don't create problems for the person wearing the cover. Some people have allergic reactions to certain chemicals. Some metals can cause skin irritation or discoloration. So bearing that in mind, that's one of the reasons why we don't leap to those treatments immediately for something that you're going to be wearing for a longer period of time, upwards of an hour on your face up against the very sensitive tissues of your nose and mouth. So the word of caution there is we don't want to do something that might inactivate viruses, but also causes harm to the wearer. The second thing is to remember that the effectiveness of the cloth face covering is not about inactivating specific viruses, but really containing the respiratory droplets that we otherwise release when we talk or cough. And that doesn't require any special treatments. There may be benefits to treatments that reduce the frequency of laundering that's needed. I've seen claims of that sort. I can't prove that it's going to be great, and I certainly can't prove that it's going to be something that would make me happy, in the sense that if I see schmutz on the face cover, I want to wash it, even if it's treated against bacteria and viruses. And I know this for a fact because I recently dropped my face cover in the footwell of my car while I was driving, and it got, a footprint right on it, right where it goes over my mouth. And I most certainly was not going to put that back on, even if it had an antiviral treatment. So, realizing that it makes sense when you first hear about it, but it may not be the most practical solution. And then finally, I worry about cost increases. When we add things like that, what is really a very humble, inexpensive, very accessible piece of equipment starts to get more and more expensive. And I don't think we really need to do that.
Yeah, I just want to add, I think that's probably one of the best points to make, that this is a low-tech potent solution that, you know, is available to everybody. But, you know, Dr. Bell, I did want to ask one thing. What if you mentioned there is this phenomenon we're seeing called maskne, sort of acne from wearing your mask that's getting some play. And I'm just wondering, is there anything wrong with lining your mask with a material like silk or something that may be more comfortable to have it up against your face?
Oh, I think that's a great point. So I know nothing about which materials are more likely to prevent maskne. I am not a dermatologist. I'm an infectious disease doc. But what I can tell you is that any fabric combination, whether it's silk or cotton or synthetics, that feels good against your face and blocks the droplets that you're breathing will be fine. Ideally, it's something that is launderable, so that you can pop it in the washing machine and then dry it in a nice hot dryer to sanitize it between uses. But as long as it meets those criteria, I would find the fabric combination that is most protective of your own skin.
Perfect, guys. Breathable, launderable, and comfortable. All the ables that you need for your masks. Dr. Brooks, a question for you. And this is one of those late-breaking virus questions. Can you address the latest concerns by some scientists that say COVID-19 is lingering in the air, airborne, and how masks can protect, or how cloth face coverings can protect and prevent the spread of this?
Yeah, that's a great question. I think sometimes people have the impression, and I look forward to Dr. Bell opining, because he made some great points about this. You know, we're really worried about those droplets, those respiratory droplets that occur in the 6 foot or so zone where you're maybe in close contact with someone. We have many years of experience with other respiratory infections, and we're learning with this one as well, that that's a critical amount of space. Now, there's nothing particularly magical about exactly 6 feet. Some people it may be 6.5 feet, other people it may be 5.5 feet, but just 6 feet is kind of a rule of thumb. When we're speaking and vocalizing, there are particles of many sizes that will come out of our mouth. And there's some recent research that does show that some of them are in that very small particle size, the size called aerosol size droplets that are real small, like down to something called 5 microns or less. And yeah, those can float around in the air for some time because that's just the way they're made, and they end up suspending that way. And in a very controlled laboratory experiment, which I just want to caution is not the real world necessarily, sure, if I spike that sample with a lot of virus, maybe I can keep culturing the virus out of those little particles for a couple of hours. I want to say, though, that doing that during the entire period of time that particle's floating there, the number of infectious particles of virus in that droplet are getting smaller and smaller and smaller. Epidemiologically, despite the fact that this is a possibility, we got to put together what is possible versus what we observe epidemiologically. And epidemiologically, we just haven't seen compelling evidence that transmission of aerosols that are airborne and travel over long distances are responsible for infecting people in a meaningful number of people. I think, as Dr. Bell alluded, we haven't seen people who are infected standing way across the room from someone. Or let's say somebody who's been an infectious person who may have been temporarily in a closed or tight space left, and then people pass through that space, like an elevator. Or air handling systems, where I'm in an office space and there's an office next door to me. Our doors are closed, but the air handling system may be, carrying the air from one room to another. We haven't seen transmission happen that way. And as we're getting to 11 million infections worldwide, it's hard for me to imagine that somebody wouldn't have documented a transmission like that. That being said, sure, there are circumstances, unique, special circumstances, where people make a lot of respiratory droplets. Dr. Bell alluded to the choir, and that's a great example. And there may have been some aerosol there, but it's the concentration that you're worried about. There's an example of a woman who was teaching a Zumba class in Seoul, South Korea, and she was at the front of the classroom, and there were about 20 other women in the class, and she efficiently spread that virus to a goodly number of folks in the room. But the point here is that they were all working full court press on 8 cylinders. I don't know if you've done Zumba, but it was like 50 minutes of respiratory hell. I mean, they were really pumping out the respiratory droplets, okay? And there's another really interesting story I just read, comes from Slovenia, where 2 men were playing a squash game together. For those of you who don't know, squash is like you get together with little rackets and a little ball in a little room. It's kind of really little and tight, and there wasn't a lot of ventilation in there, and they're bashing this ball around for 50 minutes, and really you do that to build a big sweat. In fact, part of what people like about squash is they get hot and sweaty and it feels really good. Well, that you're leaving behind a room full of respiratory droplets. And these guys left the room, and they have doors that seal nice and tight shut because the ball has to be able to bounce off a flat door without a crease. Then another couple of guys come in there, and guess what? Turns out of the 2 guys that played before them, one of those players spiked a fever an hour later. He was just becoming sick, and that's when we know people are most infectious too, just before they get sick and just after they develop symptoms. And both people who played in the room after him for an hour got sick. And I mean, I wasn't particularly surprised. People are like, oh, this is horrible. I'm like, well, when you really push the limit, you can maybe make it happen. The good news here is that ventilation's your best friend, and I think I said this before. Diluting the air, stepping up the air circulation in a closed building, opening doors and windows to the extent you can. Eating out, if you go to a restaurant, eat on the terrace, not inside. Be outdoors where fresh air can dilute and reduce your potential exposure to these particles. That's really going to be your best friend.
Perfect. Thank you. Thank you so much, Dr. Brooks. Well, everyone.
And if I can add just very
please,
quickly,
Dr. Bell. Yes, go on.
On the subject of the airborne piece, it's important to remember that when we generate droplets by speaking or coughing or what have you, they get smaller the further away they get from us. And there are good studies showing that if you can trap them close to the source, then you don't generate as many small particles that could be inhaled further away. And that gets us back to the importance of source control and using a cloth face cover. By trapping all of those droplets right where they're made, we're producing far fewer of these potentially inhalable small particles.
Yeah, that's an excellent point. There's a really beautiful demonstration of that in a recent publication where they use this. Did I say this before? Where they use this green light to illuminate what your breath looks like. Yeah. And so they looked at, putting on like quilted cotton fabric or other kinds of fabrics. And, without one, what's coming out of your mouth goes a couple feet. But with one of these, even the small particles are being held back and kept close to you so they don't go that long distance that Dr. Bell's talking about.
Great. Thank you for pointing that out. Well, guys, we have come to the end. This is going to conclude our time together. We've had a really good time. This has been a super hot topic. When we were discussing bringing this topic to the table, I was excited about it because I know I've gotten a lot of questions from family and friends, and a lot of my friends have gotten questions and colleagues have gotten questions. So I'm so excited that Dr. Brooks and Dr. Bell could join us today. Do either of you gentlemen have any closing remarks for us? I'll start with Dr. Brooks first.
I just want to remind people that face coverings is probably one of the most potent interventions you have under your control to help your community stay safe. Yeah, face coverings, as Dr. Bell pointed out, maybe not the best way for preventing ourselves from inhaling something, which is often how we think of masks. But don't forget that we're really worried about this problem, which is becoming important, that people are able to transmit the infection before they know it. The more that everybody in the community wears a mask, the more that all of us are covered from getting infection.
Thank you. Dr. Bell.
I couldn't have said it better. Thank you for joining us today.
Thank you, Dr. Bell.
I'm sending you the check, Mike.
Thank you, everyone, for joining our call today. A recording will be posted online on CDC's COVID-19 webpage. Don't forget the subscription link to receive future updates and invitations is listed on the screen, so please click away. And thank you again. Please join us next week for a situational update on COVID-19 and a hearty discussion on considerations for K-12 and institutes for higher education. Talk to you guys next week. Bye-bye.